Thank you, Madam Chair, and thank you to all of our witnesses today for talking in such frank terms about how to take away stigma and address the real issues at hand, which are, drug addiction and treatment and finding the right time and mitigating mortality. I very much appreciate that focus on how to care for our families and our communities. I want to turn to Dr. Wilson for my question. Doctor, I very much appreciate your candor about how physicians in general do not receive sufficient education on how to recognize and treat substance abuse disorders. My state of Washington has been a leader in working to integrate behavioral health into primary care and utilize care coordination so people with complex conditions, whether that's diabetes and depression or co-addiction to opioids and methamphetamines, can get the care that they need. And yet, personally, as a pediatrician, the extent to which I personally treated substance use disorder was screening for it, and then if I found it, ensuring immediate safety and then referring out to specialists. And so I was wondering, from a pediatrician's perspective, could you just talk about what it looks like to treat a patient with substance abuse disorder in the primary care setting?
Absolutely. I often think of addiction as a pediatrics disease that we often fail to recognize and treat during childhood, which leads to worse outcomes later in life. The vast majority of adults who use substances have actually started using those substances during their adolescence. And so this is a huge missed opportunity to really shift the life trajectory of a generation of adolescents and young adults. So I think it is essential that we do a much better job as a profession of recognizing substance use in young people. As a pediatrician and adolescent medicine provider, I think I am the sort of perfect person to recognize substance use in my patients. Pediatricians have the ability to build deep relationships with patients and their families over time. We provide lots of anticipatory guidance and education about what to expect as you grow up, about puberty, about all sorts of things that we know are going to impact the lives of our patients. And we know that substance use is a huge potential area that would have serious impact on their future. And so I think it's natural for us to be the ones to sort of have those kind of preventive conversations and start the conversations with patients. We also see patients regularly for well child visits, and that's a perfect opportunity to screen patients as we're doing a lot of preventive health care. And then to sort of offer treatment in the setting, it helps sort of remove some of the stigma that both patients and their families might have about the disease of addiction, right? So I don't say you have an addiction, you have to go someplace else. I say you have a disease just like you have asthma, and as your doctor, I'm going to treat you. And there's something that is so powerful about sort of flipping that narrative for parents. There is nothing shameful about dealing with addiction. It is a disease, and we have effective treatments. And our job as physicians and pediatricians are to get those effective therapies to children and their parents.
So I really appreciate that perspective. And I think it's really nice to destigmatize it like that. I guess here's my next question. I am in a generation that did not receive this kind of training in medical school or residency. And I understand that, the X waiver may not be ideal, but then again, less than, I think, 1% of pediatricians have ever even applied for the X waiver, so aren't in a situation to do this testing. Can you talk about, if it's not, what your thoughts are about the X waiver, and if it's not that, how do you catch the more experienced doctors up to speed on treating substance abuse disorders?
And if you could just, excuse me, if you could just summarize your answer, because the gentlewoman's time has expired.
Oh, I missed that. You can do
it hasn't. I'm sorry. You have 37 seconds.
Okay.
I'm sorry.
So I think we have to both integrate for sort of our learners into health professional education and medical residency programs, better education in addiction. And I think the X waiver training is sort of an additional regulatory hurdle. I think we should eliminate the X waiver training, but integrate basic tenets of addiction medicine as sort of linked to, for example, DEA licensure. So as you sort of obtain your DEA license, you have to complete a certain amount of hours related to basics related to addiction and buprenorphine prescribing. So all prescribers who are able to prescribe controlled substances are actually also able to recognize, treat, or refer to treat patients with addiction.
Great, thank you very much.